So the heart rate variability is the balance between your sympathetic and parasympathetic system. So what does that mean? When we have like a crazy day, stressful, we call it fight or flight, we're gonna have our heart rate going fast. So the HRV gonna be very low. So like the QRS, the heartbeat gonna be close to each other. Your heart keep going hard. Now, it's part of life to be stressed, to be working hard. Now, when you sleep, which we believe the sleep is very critical part of improving your HRV, we start getting the parasympathetic drive, which is, we call it rest and digest, or digest, like rest, take it easy, the food need to take a while. So your heart rate starts slowing down. And that's the function of good sleep. We can get you to depth to have your heart rate down and rest. So the HRV will be high. So the HRV from low when you're stressed to be high when you're resting. And that changes. It's going to be very important for you to see that you have a very good restoring, resting sleep.
Hey everyone, welcome to the Precision Medicine Made Simple podcast. We are back with Dr. Jarbou. And so in his episode, we actually talked about how we were going to do my VO₂ Max and then my sleep study. And so here is the continuation. I have no idea what the results are. So this is where Dr. Jarbou is going to be going through a review of just what's been going on. So welcome back to the show, Dr. Jarbou.
Thank you, Taylor. Thanks for having me.
Yeah. And so right before I said the intro, I was saying that Marmar made me dry heave on the VO₂ Max.
Did you record that episode?
Yeah, so we actually did. So we recorded everything, and I was going to compile a video together from start to finish of just what that looked like, and then also including the sleep study too. Well, not recording me sleeping, but at least recording.
Yes. Yeah. I think the VO₂ Max is, again, it's give you like really a great game plan for improvement. It's like a lot of people get disappointed from the VO₂ Max, but I look at it in the other way around. You have good start, you're very young, and it's doable to improve your VO₂ Max.
Yeah, it's funny that you say that, because when we were recording, I remember Bill actually asked me this question. I was actually disappointed when I saw my VO₂ Max. I thought I would do better.
Yes, I understand. It's not only, it's a lot of our clients get disappointed, and then some of them actually they were impressive. Like they're more than impressive, but it was expected. The majority of us, when we exercise and if we don't have a clear goal of what are we going to achieve in the next 6 months to a year, we get lost in just having fun, enjoying it, working out. Working out is still great, but to take it to the next level and use the data to improve your VO₂ Max, to improve your general health, to improve your longevity, that is the way to go. And that's what the VO₂ Max provide you as a baseline. And then 6 months, a year from now, we'll see if our program, our recommendation worked for you or not. We'll be glad to do the test again.
Yeah.
So Is your VO2 max correlating with the number on your Garmin watch?
It was pretty close. I think from what I remember, the VO2 max that I got when I was at your clinic was 29. Is that right?
I think so. I need to look it up. We reviewed it a couple of weeks ago, me and Marmar, but we need to do just an episode about VO2 max. So like what we're going to do today, I think what I'm going to do, I'm going to share my screen with you in a few
Okay.
minutes.
Yeah,
If
let's do it.
it's up to you. If you
Yeah.
don't mind. And then I will show you your sleep study and explain to you again, as we talked in the first time we met, that we are believer in fitness, nutrition, and sleep as the pillars of your health. And these are the basic that everyone should be evaluating themselves. You don't have to go fancy testing, but if you have some symptoms or your girlfriend complaining of you snoring, you need to take it to the next level and do the sleep test. So how was your experience with the sleep test?
Yeah, so my experience with the sleep test, it was a little uncomfortable. At first. And the only part that was uncomfortable was the finger. So I believe it. So it's the watch pad. I mean, it attached to the finger, and then I believe I had one attachment where like a sticker to my chest, right?
Mm-hmm.
Right. And then, but it was just the finger that was like pretty tight. And so I remember Cynthia mentioning some people if some people have complaints where they put it on their pointer finger, their index finger, it might be a little bit too tight. And so people have opted to put it on their pinky instead. I wish I should have listened to that advice. Just because it was a little tight. And so it did have me, I mean, it was just a minor inconvenience in the beginning. But after that, though, I was able to sleep right through and it was fine.
So the technology with this sleep study depend on measuring the pressure and the changes in the pressure inside the arteries. And that's where is PAT coming from, watch pad. So all sleep study in general, like it have been great technology for us over the last 15 years. So did you ever see anyone going into in-lab sleep studies?
I've only heard of it.
Okay.
And
So
I've
in-lab
heard
sleep
it sucks.
still our gold standard for sleep evaluation.
Okay.
The problem with it, you have to go to a hospital or to independent sleep lab. You have to spend the night there. You have to be connected to multiple channels, including EEG in your head. Someone like me, old, not a problem. But imagine having all these electrodes connected to your hair with a gel and connecting like a robot to a big machine, including the cannula in your nose, like an EKG type of monitoring, muscle movement monitoring in your legs. So there's multiple channels, more than 20 to 30 channels of all different electrodes connected. Then watchpad technology came on and we have only 7 variables that we measure. And it's done at home with a smartwatch, as you saw, connected to your finger and one to the upper chest. We call these a level 3 sleep studies.
Level 3 sleep.
We have something called level 4, which had only 3 variables, and it just go to your fingertip. That's it. Only small probe into the finger, connect to your phone, and then you use it at home. So sleeping in your bed, sleeping in your environment, in your pillow, it's priceless. So the majority of patients really don't need the in-lab sleep study, which is very expensive, take a lot of effort, take a lot of planning. So we did the home sleep study for you. Your experience is typical, honestly, especially for a young patient like you. It's a little bit discomfort, but it's doable, and you can sleep with it overnight. You had to connect it to your phone. Is that correct? To your smartphone.
Yeah, I just needed to connect it to my smartphone.
And the data is stored in the app until the morning. And as soon as you turn it off, the data gets sent to us, to your physician or to the ordering physician.
Right.
And then how is your sleep in general?
So I've been trying to focus more on sleep. And so actually from the last episode, I mean, I haven't been the greatest at some of the rules, but I've been trying to at least, I'm a little bit more aware of some of the rules. So, like you mentioned, the 4, 3, 2, 1.
What?
Yeah. And I think the only thing I was able to really do is just no drinking or food, but it
Okay.
was like the screen time and the exercise that was a little bit more of a challenge. Um,
That's a great start. Again, these are again rules to try to stick around them. We're human. You have social life. You have commitment. Sometimes you travel a lot. You cannot do it all the time. But if you stick around them in general and try to make it a habit, it will help.
yeah.
Now, the
I,
4 I know is hard because you need to work out. It's a
yeah.
priority for me to work out. A lot of patients, a lot of clients, they do very well with working out within 3 hours of sleep, but in general, it's a good idea. Try to avoid it 3 to 4 hours before bed.
I actually think that one of the reasons I ruptured my patellar tendon was because of lack of sleep.
Mhm.
And when I was playing basketball, I think the night before I only had like 2 or 3 hours of sleep. And so I think my body just wasn't adjusting to
Yeah,
my reflexes and put me in a really tough position.
yeah, and then again, it's like almost if you don't sleep well, you're almost like drunk. Alcohol level is high, and so you don't pay attention. There's not the best coordination, and that's your increased risk for injuries, unfortunately.
Is so question then, is the main factor for recovery then the HRV then? Because I noticed like just within that metric, like if I'm tracking it and then the next morning, let's say that I had an alcoholic drink the night before or I didn't get much sleep, my HRV is
Low.
not very good. Is it low or or high?
Yeah.
I forget which one's better or
So,
not.
so, so the heart. Okay, so it's a very good question. So it's part of the equation, heart rate variability. So the heart rate variability is the balance between your sympathetic and parasympathetic system.
Mhm.
So what does that mean? When we have like a crazy day, stressful, we call it fight or flight, we're gonna have our heart rate going fast. So the HRV gonna be very low. So like like the QRS, the heartbeat gonna be close to each other. Do your heart keep going hard? It's part of life to be stressed, to be working hard. Now, when you sleep, which we believe the sleep is very critical part of improving your HRV, we start getting the parasympathetic drive,
Hmm.
which is we call it rest and digest, or digest like rest. They take it easy. You need to the food need to take a while, so your heart rate starts slowing down, and that's the function of good sleep. If we can get your depth to have your heart rate down and rest, so the HRV will be high. So the HRV from low when you're stressed to be high when you're resting. And that changes going to be very important for you to see that you have a very good restoring resting sleep.
Hmm. So that's one
Now,
of the main drivers. And is that also, I'm just one of, man, this, I guess this brings up another question then as we're talking about sleep studies here is, I mean, what's really popular are Aura rings. I mean, is it really
yep.
great to, is that a pretty accurate study then in comparison to what I did with the watch pad? I can imagine without
It's
the
not
other.
accurate, so it's not, so they are not, smartwatches or a ring are not a diagnostic approved FDA devices for sleep apnea, but
Hmm.
they give a lot of data, including your sleep hours. They think they can tell you the depth of your sleep, which is again, it's questionable. But it's like yesterday, I was reading their report when they reviewed all the data in the last 3 years for their client who used the ring, their HRV, their sleep quality related to drinking alcohol.
Hmm.
About 15% worsening in the HRV and the sleep quality and the sleep structure. And I can send you the link for it so we can have it in the notes. It's very interesting, and as you can see the graphs with alcohol drinking before bed, like in the 2 to 3 hours before bed.
Ooh, yeah, we'll definitely put it in the show notes.
Yes, it's very interesting data. So again, we're not there yet. Apple Watches now can tell or suggest in 20 to 30 days after use it every night, it can suggest that maybe you have sleep apnea.
Hmm.
Okay. And sleep apnea, as we talked about, it's a mechanical obstruction in the airway. So let's talk about first. Let's finish the HRV point.
Okay.
So with the HRV, it's give you a nice, reasonable indicator if you're ready to push it next day, if you rested well, and you just adjustment. It give you a very good feedback about if alcohol causing your HRV not to be good elevated, and your HRV is still low, or your HRV is like flat, is not, you're not resting. So we look at the reason for your HRV not to be good, including the well-known obstructive sleep apnea, which is, as I'm saying, it's a mechanical obstruction in the upper airway. It's actually in the back of the throat here, where the upper airway, whenever you start partially collapsing, the air is not flowing right. So that's like a lot of times snoring. Snoring is not a medical problem. It is a social problem. But this is the main reason for me to see patients, because of your spouse, because your significant other, or your neighbors complaining that
You're
there's a
snoring.
lot of noise and snoring. So that's the main reason. But it's snoring don't cause. It's not like I say, oh my goodness, Taylor, you're gonna be in trouble. You're gonna end up with more complication medically if you don't fix the snoring. To the best of our knowledge, if it's snoring most of the time as a social problem, we try to solve with the simple medical issues like allergic sinusitis, allergic rhinitis, which is extremely common, especially in the Midwest. And it's an easy solution sometimes as easy as simple like sinus washes, salt and water washes on a regular basis. It can help a lot. So, and then sometime over-the-counter antihistamine also can help with these symptoms. Now, if that upper airway start collapsing more and more, you can hear that where it's become significant. With that upper airway collapsing more, causing like maybe 10% decrease in the airflow and start oxygen going down because of the airflow limitation, that will start counting events and problem can cause medical issues. And then we go to what we call hypopnea, which is decrease in airflow around 30%, and starts looking more deep in the oxygenation around 3 to 4%. That's what we consider significant. And then apnea, where it's like more complete obstruction. And the majority of the cases which we see the hypopnea, not the apnea. But the number which I need you to remember today, it's called AHI, which is apnea, hypopnea, index, which is how many events you get per hour. Fair enough so far?
Mm-hmm.
So
Yeah, right.
AHI will decide if you have a sleep apnea, the severity of your sleep apnea, and then if we need to treat it or not. So we do see significant sleep apnea causing the HRV to continue to be low because you're not resting enough at night.
Mm-hmm.
Fair enough so far?
Yeah, fair.
Okay, I'm gonna see. I hope I can share my screen with you. So this is my report. I'm gonna come back to the report. I'm gonna share some data first.
Whoa.
So we see that the study started at 10:48 p.m.
Okay.
and ended at 6:11 a.m. Recording was around 7 hours 23 minutes, but the total sleep time is 6 hours and 18 minutes. So we do see how, like, with this is only your total sleep. Do you think this is like a good average sleep or reflecting your regular sleep hours?
Yeah, I think it is reflecting my regular sleep hours. It's anywhere between 5 to 6 hours of what I usually get.
So this is our first problem.
Oh.
Yes. Okay. Let me show you why. And let me see if I can increase it in size. Okay. Percentage of REM of sleep time. So this is 28%.
Okay. 28% of my sleep is
What REM?
in REM.
Yeah. And do you know what's REM?
Yes.
So REM, yes. So it's a rapid eye movement, which means, so we have two different types of sleep. Either it's REM or non-REM. As simple as that. Okay. REM is the dream sleep. where we go with atonia, because we go paralyzed. Our muscles stop moving because you don't want to act in your dreams. So imagine you're trying to act on your dreams and you're moving your muscle, and that's very dangerous. And it's actually, there is a disorder called REM behavior sleep disorder that we treat and we diagnose. It's a significant problem. Okay. So REM is dream sleep that you go atonic, you go paralyzed. Only your rapid eye movement, only the eye move fast enough, and you can see it. Now, someone like you, I'm expecting you to be around 20%, maybe maximum 25%. But when I see 28%, that high REM sleep time. So tell me here, there can be a lot of medical problem, but the most common, which you give me the answer just a minute ago, is sleep deprivation. And we call it sleep REM rebound. When you rebound and have to have more REM because you did not sleep good for a few days.
So it's almost like, so this is like me catching up then. So like
Catching up, but it's not the same as you get sleeping the 7 to 8 hours of sleep. You need 7.5 to 8 hours of sleep every day.
Hmm.
Majority of us, we need that. There's few people that don't. But I'm telling you, like thousands of patients, 10, 15,000 patients I've seen in the last 20 years, maybe one of them truly needed only 4 hours of sleep. Everyone else needed 8 hours of sleep.
So I just had I actually have a couple
Right.
quick questions here. So you mentioned that usually people my age are around the 20 to 25% of REM of sleep time, right?
Mm.
But
Yes.
my initial assumption is that the higher REM I get, the better than,
No, no,
no. Okay.
no.
As long as it's
Yeah,
consistent
oh,
at
yeah. Well,
20.
very good. I see your point. I got you there. So, Taylor, what you need, REM sleep is not the deep sleep.
Oh,
It's not the restoring. It's not the best sleep. Okay.
oh, okay. I
So,
thought it was
so we have,
really,
yeah, that's actually a lot of people, even but professional, think that this is the no REM sleep. It's amazing. REM sleep, where the dream, it's more complicated. But the most important sleep for you is, we call it non-REM stage 3. That is the deep sleep. Which,
mm,
with this home sleep study, I cannot tell you which stages you're in and what your non-REM sleep stages were.
hmm,
Can measure through the artery your REM sleep time, but a full sleep study will be required with EEG monitoring to tell your brain which waves and at which stage. So this is no. The N3 is the most significant sleep that if you get it, you feel great in the morning. You feel refreshed. It's the best sleep. You slow down, you dip your blood pressure, your heart rate, and you're the most relaxed.
hmm.
So REM sleep is not the same. REM sleep, there's a lot of theories about it. But the way I like to describe REM sleep is that you have a flash drive. We're talking about computer here. You
Hmm.
have a flash drive, a small memory, wherever you're getting memories in your flash drive. Now, the REM sleep, we think one of their job, the REM, is to move that flash drive memory, the short memory,
But,
to a long-term memory, which is the hard drive.
mm,
That is huge for function, for your memories, for your personal, for your like the rest of your life function. Give you a bad example here is, my goodness, the post-traumatic stress disorder. Unfortunately, these people, like when they have that problem from a significant car accident or they were in a war zone, that flash memory don't ever go to the hard drive. So they continue to live that memory again and again and again in the short term. You see, it gets more complicated, but sleep medicine is amazing
hmm.
because we know some stuff, but there's a lot of information that we don't know yet.
Ah,
So REM sleep is great. You need it. You need to like restore your like memories, have like improve your long-term memory. That's the reason why I tell a lot of students sleep is more important for you than studying last minute. Because if you study last minute and you don't go to bed and you don't sleep well, you're not gonna move these short-term memories, which you studied last minute, to make it a long-term memory or in the hard drive. So you're not gonna benefit from it second day in your exam.
Interesting. I mean, in a way, it almost feels kind of ironic considering, well, I mean, I'm sure, would you say it's pretty common that a lot of doctors know the benefits and power of sleep, yet they're all sleep deprived because they have
I don't
so
think we
much
so
on their
when I
plate?
was in medical school in the 1990s, and I'm that old, yes, like we did not have sleep medicine, and
Mm,
it came more and more in the 2000s. And most of our physicians, we were sleep deprived because we did have, my generation had the 80 to 90 hours working week. We did 120 hours. So it was huge for us to go to 60 hours a week in 2004, 2005. That was huge. So it was part of our internship, our training, but unfortunately also was not part of our education. The same, I will say, for nutrition,
mhm,
the same for fitness. So the basic of health pillars, because our focus always on the pathology of the problem, of solving diseases, on fixing sick. So we did not have the luxury to think and work on like the most important stuff in sleep. So I go back here and I tell you, I see a lot of young patients like you, high REM sleep, and their problem is sleep deprivation.
hmm,
So it's like focusing sleep, minimum 7 hours. You should be shooting for 8 hours every day will be huge.
hmm.
Fair enough so far?
Yeah, yeah, that's fair. And it cleared up a lot because I mean, I just assumed that REM
Yeah,
is
and
like,
this
oh, I'm doing great.
we're scratching the surface. Yeah, here
Okay.
and there. Okay, so here in the right side, oxygen saturation statistic, you mean oxygen 94. When dropped as low as 89 for seconds, it's nothing significant. How many events you had with oxygenation is nothing to worry about. Everything here is zeros. Everything look good. I'm not worried about it. Okay.
Okay.
Now, the most important for us are respiratory numbers. And this is where we start talking about hypopnea and apneas in general, AHI. We have to use two criteria. We use a 3%, which is drop in the oxygen 3%, or 4%. And 4% because of Medicare, they request for us, for elderly patient, to use 4% to count how many events. And for American Association of Sleep Medicine, we use 3%. So it's just type of reading these sleep studies. And then we count how many events all night long, if you have the 3% or you have the 4% oxygen drop. And this is the most important number. For you, your AHI is 5.6 using the 3% criteria. So, and this is by definition, it's mild obstructive sleep apnea.
Hmm.
And this is very mild. You did have a few events. They were more in REM sleep, which make more sense because during the sleep, REM sleep, as I told you, you go paralyzed, Tony, there's no muscle tone there. So the muscle collapse in the upper airway. And you had more events during the REM, which you had around 10 per hour. So your average for 6 hours, 18 minutes of actual sleep, total was 5.6. Make sense so far?
Yeah, I guess I'm just like a little bit confused
Or
with PAHI and then the 3% versus the 4%. And then I
yeah.
mean in NRREM is non-REM, I'm
No,
assuming?
yeah, that's the stage 1, 2, and 3.
Stage 1, 2, and 3. Okay.
Yeah. So
Gotcha.
yeah, let me explain it one more time. So American Association of Sleep Medicine
Okay.
find out that we were missing a lot of patients with diagnosis, especially the mild sleep apnea,
Hmm.
because we were looking at the drop in the oxygen flow, in the airflow, 30%, and oxygen dipping down in your system. around 4%. So if it was not 4%, they did not want to consider it significant. Many years ago, we had so many discussions that we need to change the criteria. And the American Association of Sleep Medicine agreed on changing it to 3%. So if you drop 3%, we count one event.
Okay.
But Medicare, Central Medical Services, CMS said, no, we're sticking with the 4%. With our elderly population, 4% is significant. Maybe younger population, you want to catch like more events and less issues. Even if they drop 3%, that's significant for them. Elderly, 3% is nothing for them. So, we do use two criteria. And to make it short, if we use the 3% criteria, you have 5 events per hour, 5.6 events per hour. If we use the 4% criteria, the older patient criteria, we count it only 2.6. So you did
4%.
drop 3. Yeah.
Oh, wait. So sorry to interrupt, but the 4%, if I'm 2.6, that would mean I'm good then?
Yes, you don't have, but you're not 65 years old, young man.
Okay. Right.
Okay.
Fair.
So that's the reason why the 4% we keep it for older patients.
Gotcha. Okay.
The young patient like you, absolutely, I would go with the 3%.
3%. Okay. So 5.6, mild obstructive sleep apnea.
And I will explain it more here in a second. Let me finish this page. And this is where, again, like the desaturation explained, and this is calculated on your hours of sleep.
Okay.
Now, we also check, this is the nice about this device. It's an FDA-approved device to detect atrial fibrillation, irregular heart rhythm, which is huge. And you did not have it.
Okay.
And I do see a lot for elderly patients. I catch the AFib first time in their lives doing the sleep study.
Oh, okay. Great.
Okay, now let me show you this. This is explain the severity of the sleep apnea. And this is where the green area here, if you have an apnea-hypopnea index less than 5, you see that green area.
Mm-hmm.
It's that what it mean? It mean no obstructive sleep apnea disorder. There was obstructive events, but no significant obstructive disorder. Between 5 and 15, it's a mild obstructive sleep apnea. You can see here how it's becoming from greenish more and more to yellowish.
Right.
So you are barely above the diagnosis. So 5.6 event diagnosis for mild sleep apnea is 5. 15 and above, we consider moderate. 30 and above, considered severe. And the majority of my patients who I see in my clinic are severe. Sure. So this is one of the variables that we watch, our snoring body position. And you can see here, like with the position setting, prone, left side, right side, and supine. And then the orange spikes are the snoring and the sound. Oh. So you see the snoring is not bad. It's mild. And we try to correlate it with the position. And like I see it here, there, more in whenever you're on your supine, like when you were on your right side here, you didn't have any significant snoring. When you were on your left side here, no significant snoring. And then I see more spike here when you are on your back. So that where positional therapy help and try to keep you away from your back, so your significant other will not have the snoring. And so that's where like sometimes we adjust your head, and that will take care of the snoring.
Okay.
Again, the oxygen saturation, we want to be sure the oxygen above 90, and you're doing very well with it there. No problem. This is the PAT, which is an amp. It's the tonometry of the peripheral artery, and it's measurement of the pressure inside the small arteries, and it correlates with the sleep stages. This is the pulse rate, cardiac arrhythmia, and finally the sleep stages. And the red one is the REM sleep. And you see that's normal after 90-minute cycle, and another one here, and you see it even more REM before even you woke up.
And L
These
sleep and D sleep? Sorry, I didn't mean to, I was
go ahead.
trying to figure out the L sleep and D sleep. There's
Yeah, they're
REM,
trying
L
to
sleep.
relate with light sleep and deep
Oh,
sleep.
light sleep, not
Yeah,
left sleep. And
yeah,
okay,
no, and they try to correlate with the sleep stages. Unfortunately, it's not very accurate as doing EEG and doing
okay,
stage 1, 2, and 3 non-REM. So, and this is the deep sleep which you really need, the stage 3
okay,
of
gotcha.
non-REM. So these are a lot of other numbers. You don't need to worry about it. This is the snoring level. This is the like how much time you slept and how much time you stay awake. And this is how much we think you had light, REM, and deep sleep to be 100%, which is it's good. Again, it's just the REM sleep is a little bit more than what I would expect for you.
Hmm.
So I go to my reporting now, and where I report in my diagnosis, I have to report using the ASM criteria. You did have mild obstructive sleep apnea. You did have mild intermittent snoring. And I think you have excessive sleepiness
Hmm.
from being chronically sleep deprived.
Yeah.
Unfortunately, I'm giving these diagnoses. Now, the nice about it, I know you, but I did not edit my report. I did my report as if I don't know who's there.
Okay.
Okay. I did it so the primary doctor can see it and talk about it. And then if we say, if you have my sleep apnea, we do not treat it most of the time. We treat obstructive sleep apnea if you have excessive daytime sleepiness, tiredness, if you have high blood pressure, if you have heart disease, if you have history of stroke, if you have depression or anxiety disorder or significant insomnia. So here is where I talk about it for me as a physician, knowing you. Honestly, I don't think you need therapy right now.
Hmm.
I think the most important is optimizing your sleep, sleeping better, getting better sleep. Then I would love for you to continue having good weight, not to gain weight. Now, for a while, we thought that obstructive sleep apnea only associated with being overweight, and we were wrong. It's more genetics, more run in families, and weight can improve the sleep apnea. So if you become an overweight and you lose muscle mass, your sleep apnea gonna get worse. Now, if I see someone who's obese with significant sleep apnea, likely they're not gonna get rid of their sleep apnea with losing weight, but their severity of the sleep apnea will improve.
Hmm.
And that was now GLP-1 therapy, tirzepatide, what is like it's the other name is Zepbound, is an FDA approved medicine to treat severe obstructive sleep apnea.
Hmm.
So we always recommend to weight gain within 10% of ideal weight. Now, I do put my general recommendation to start auto CPAP therapy as the best option to treat, which is going to open your airway. So if you have moderate or severe sleep apnea, I'm not going to leave you today before starting your auto CPAP. So you have a very mild sleep apnea. Your symptoms not bad. I think we can focus more on the sleep hours and good sleep hygiene and improve your sleep quality. Much better than trying to focus on CPAP therapy for now. Fair enough?
Yeah. Yeah. That's fair.
Again, dental appliances is an option, which is a mouth guard. It's a designed by like a dentist, and they charge your medical insurance, not your dental insurance. And it can help. But also, the problem with anything dental in our country, unfortunately, is very expensive. So your copayment will be very high. I have a lot of patients, they really benefit from the oral appliances. My recommendation always absolutely avoid alcohol. It's really disturbed typical sleep archetype. And then I do my general recommendation, what we call positional therapy. So when you were on your back, your sleep apnea was a little bit worse and your snoring was worse. So sometimes we fix my sleep apnea like yours by preventing you from sleeping in your back.
Okay.
And it's very simple. Sometimes we place a ball in the middle of your back on your t-shirt or your jersey, wherever you prefer to like, and like have like something in your back to prevent you from your like, if you prefer like a specific t-shirt, yeah, just we literally have a maybe sock, have a like a tennis ball in it, sew to your t-shirt, or have a pillow where you cannot sleep in your back.
Like one of those pregnancy pillows, right?
Kind of like, but it's going to be in your back though. I mean,
Right.
you can hang one that it can be between your legs,
Okay.
but so, and Amazon, they have some crazy ideas like that you can try. I did not personally try, so I cannot recommend
Okay.
it. So, so that is what we call positional therapy.
Okay, so I have questions now.
Right, please.
Well, so because now I'm thinking about excessive sleepiness, right? Main
Mhm.
thing in trying to improve sleep. I can't recall if we talked about this in the previous episode, but one thing that really stuck out to me from that episode though was just going to bed and waking up always at the same time, and that's one of the most important things. If you're a little bit sleepy, that's fine. You're just going to start to have to build that habit. But one
Mhm.
thing that I feel like throws it off is naps.
Mhm.
Trying to catch up on sleep. Then,
Well,
and so, nope, bad. You're shaking your head. No naps, bad, not
well,
good for catching up.
no, 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 don't, because it's going to disturb your sleep. You need to build up your sleep drive to the end of the day.
Okay.
But by the end of the day, it's like you need to do being awake during the day, no naps. That's highly recommended.
Okay.
Optimizing sleep hygiene, it's really critical. It's like for you, it's a building a habit, especially for us now, with all of us dealing with the social media, all this light exposure or TV. Even if you want to watch an NBA game now, like even the NFL Sunday, no, now Thursday, Sunday, and Monday,
It's
it's
always
gonna the service, but and you have to be part, like you have to be part of it, like, and for sure, like it's really part of our society. For you to interact, to enjoy what you like, it sometimes can happen. But I tell my patient, yep, if you could do what we call social jet lag, you just take it for one day. Second day, you're sleepy, you're tired, you don't go to bed early, you don't take naps, just make it one day and get back in bed following day at 10 p.m. and wake up at 6 every day.
okay.
Any other questions so far about your sleep study?
No, I mean this is very helpful, and even just the data on the position as well. Well,
Mhm.
and I guess now this goes back to the original or one of the questions that we had while we were diving into this. Then is like, yes, I can focus on this now. Is there a point of no return though? Once you get to, let's say, like severe, and I mean, I guess, oh man, I'm answering some of my own questions here. It's like, if I
Yeah,
focus
no,
on the things that we're talking about now, I'm
yeah,
going to avoid getting severe, and I'm proactive
yeah. I
about it
think I
later on.
think the most important for you to work on sleep hygiene, getting more
Sleep hygiene.
sleep. Okay,
Okay.
that's the most important. Do I want to give you a trial of therapy on CPAP? Yes, but I think my problem right now, if I give you the CPAP therapy, is going to affect your sleep. Going to take you a while to get used to it. I do prefer someone young like you, healthy. Yeah, you don't have high blood pressure. You don't have any history of stroke or heart disease. Let's not do the CPAP therapy yet.
Okay.
Now, if you gain weight, if you're sleeping 7 to 8 hours and you're still sleepy and tired during the day, if you get high blood pressure, unfortunately, I need to treat your sleep apnea. Now, your sleep apnea is not going to jump from mild to severe overnight. maybe 20, 30 years from now, if you don't take care of yourself, you lose muscle mass, you're 350 pounds, maybe your sleep apnea going to be severe.
Mm.
And someone smart like you, young professional, I don't see it happening.
I hope not. Yeah,
See,
I don't
not-
see it happening either.
yeah. Again, in the other way around, we want you to live to be 100 in a very good, healthy, and productive way. And that's the reason why we're talking about this. That's the reason why we're doing the VO2 max, the sleep, the nutrition.
So now I mean, I feel like we're gonna have to talk about VO2 Max on another episode then, because I mean,
Absolutely, yes.
we did like
Uh,
sleep study.
Why to do like 30 minutes, 45 minutes just about your, if you don't mind, about your VO2 max.
Yeah. We can do that. We can definitely schedule. Well, because I know we're only supposed to go till the top of the hour, but I was just gonna have sort of an anecdote here. Whenever I work out a lot harder and I really get my heart rate up, I always feel that I have better sleep later on in the
Yeah,
evening. And so I can
that-
sort of see how these things are sort of blending together and they kind of feed into one over the other. And it's kind of like a cycle. Because if I do have better sleep, I can also wake up earlier and also and work out a little bit harder. And so
yes.
they go hand in hand from what I'm seeing.
And a lot of time we get stuck in vicious cycle that we cannot break it. You're tired, you're sleepy, you're not sleeping good, you're not working out because you're not feeling well. So you're mentally tired by the end of the day, but not physically tired. So let's go back. Sleep structure, sleep hygiene is the most important for you and for majority of our patient, a younger patient. And then if there is still issues with significant snoring, significant sleepiness, high blood pressure at young age, please talk to your doctor about getting a home sleep study. It's very convenient. It's easy to do. It's much cheaper than in-lab sleep study. I, I mean, these are only like $200 to $300 cost comparing to like thousands of dollars for the sleep lab. So it's doable. Even if you don't have good insurance, you can do it out of pocket for much cheaper than what your copayment going to be.
Hmm.
So it's doable, but focus on the simple stuff first. Let's focus on the 80%, which is good sleep hygiene, good sleep structure. And then tell you what I'm going to recommend for you in 1 to 2 years, repeating the sleep study.
Okay.
And it's really simple. It's like, but you cannot gain weight, you need to lose some fat. Maybe, we need to do a DEXA scan also for you, my friend.
I would love to. I've never done a DEXA scan before.
We'll do a body composition scan, DEXA scan, and we'll discuss it. They're really helpful. It can tell you what's your muscle mass, what's your bone mineral, what's your fat ratio. And then we can do one in 2 years also.
I think what's really cool is like I mean, from our first podcast episode, and we're now starting to do this, I can really envision and see the entire picture sort of being put together and how you're approaching your patients with just a very holistic approach from, VO2 max to sleep study to now DEXA scan, and then even implementing the genetics and family history there as well. So, I mean, it's really cool to be a part of this whole experience, and then of course sharing with the audience.
I really enjoy it more. I enjoy spending more time with my patient, explaining all these small details because it's really make more different for you, Taylor, to understand where I'm coming from, why I'm recommending this hour sleep, to understand the REM, to understand why I think you have a sleep deprivation, and why I think you're going to benefit long term from sleeping more. And
Yeah.
then when we discuss the VO2 max, and hopefully the body composition scan, DEXA scan, also with that will explain more about the other approach about your workout, and then why when you get your heart rate up and you're physically tired, you're going to have much better sleep, and even your HRV will recover much better.
So, because should I get a DEXA scan here then and
Yeah,
send you the
we
results?
can do it. We have like a connection with multiple radiology centers. We don't use the insurance because insurance is not going to cover it for you,
Of
and they
course.
are cheap, like $150 to $200, I
Hmm.
believe. The only thing which is we try to connect, we need to be compliant with HIPAA, so we need all these medical records to go in a safe way if you get your consent to show it to everyone, yes, we'll be glad to, and we'll discuss it. We can show the report and explain to you what's our findings.
Oh yeah,
But
happy to
so
share. This is my
yeah,
verbal consent and recorded consent here.
I appreciate that, because it's different than just telling patient that we do the sleep, or it's better for them to understand it and maybe watch this before even they come and talk to me, so they have their question clear and they understand what to expect from sleep study.
Yeah. Yeah, absolutely. Well,
Very good.
yeah, I'm excited. I'm excited to share this with you and your patients and the clinic, and happy to sort of be just the person to share all this information to. So, I mean,
Okay.
I've learned a lot just from this, and I feel like I actually have some actionable recommendations that I could, I could use and really try and improve my sleep. So, thank you so much, Dr. Jarbou, and
Absolutely.
I'm excited to talk the next time where we're talking about VO2 Max and
Yeah, hopefully in December will be no more No Shave November. So by that time, I'll be younger like you.
okay. I know. I mean, this is still me at No Shave November. I mean, shoot.
I cannot do anything in that top there. So that's the reason why I'm doing it here.
Okay.
Really
Sounds good.
content. Thanks, my
Well,
friend.
thanks so much, Dr. Jarbou. Your contact information is going to be in the show notes as well. And then if you want to reach out to Dr. Jarbou, please reach out in the show notes. He's based over in Colombia. I'm learning so much. So thank you so much.